In pregnancy, you go 10 months without having a period, and then your body rewards you by giving them all back to you all at once. It's like having your period on crack. So why does this happen, and what can you do about it? Hey mommies and daddies, my name is Nellie, and I offer tips and tools to help new parents figure out their kids. If you're into that, follow me and click the link in my bio. One of the great parts of pregnancy is not having your period for about 10 months, even longer if you're breastfeeding. But you do have to heal after birth, so there will be some bleeding for a while. The uterus that used to weigh just a few ounces now weighs about 2 pounds and has to have time to shrink back down to something about the size of your fist. You also have a wound inside the uterus about the size of the dinner plate where the placenta attached, and that's bleeding, so you need time to heal. All of these things take time and may be slightly uncomfortable during the healing process. Your bleeding is going to look a little different as the weeks go by with the amount of blood that's on the pads. This type of bleeding or discharge is known as Lochia, and there are 3 different stages, and it's good to know what is going on so that you can let your doctor know. The first stage is called Lochia rubra, and this is bright red blood with blood clots in it. This is going to happen from day 0 to about day 4 postpartum. It's a heavy flow that covers a large pad every 1 to 2 hours. Now remember, nothing in the vagina for 6 weeks until you've been cleared by your doctor. So, no tampons. There should be no bad or foul smell, and you should not be soaking a large pad in less than 1 to 2 hours. Now, if you are soaking a pad in less than an hour, that could be cause for concern, but if you are soaking a pad in 15 minutes or less, that is an emergency. The pad should not contain any clots that are bigger than a ping pong ball. This could mean that there were tissues left behind and it needs to be addressed by your doctor. The second stage is called Lochia serosa, and this is a pinkish brown colored discharge that happens about 4 to 14 days postpartum. Now this is a moderate flow and it should be covering one large pad in about 4 to 5 hours and then decrease as the days progress. It should be odorless or have a slightly sweet smell with no clots present. Now when it starts to decrease, you might be like, oh, I feel so good, I want to get some stuff done around the house. But you need to listen to your body because it will tell you if you're doing too much, because it's going to make you start to bleed badly again. If this happens or you're starting to notice a bad smell, contact your doctor right away. So please, check yourself before you literally wreck yourself. Sit down and rest because you're healing. The last stage is called Lochia alba, and it's a whitish yellow color. It means you're almost done and you shouldn't see any more red at all until your next menstrual cycle. This can last from around day 14 through the end of your 6 weeks. This is a light flow and it can be contained in a panty liner. There should be no odor or clots present. Again, remember, if you start seeing any red blood or clots again, this means there could be an issue, so you need to contact your doctor. Just relax and let yourself enjoy and get to know your little one. For more tips and tools for your parenting adventure, like this video and check out my YouTube channel.